Hi, everyone, and welcome to Health Reform Beyond the Basics. Thank you for joining us for a new webinar for this series, What's New for 2025. My name is Aisat Odiale, and I'm the Health Projects Assistant at the Center on Budget and Policy Priorities, and I'll be moderating today's webinar. Beyond the Basics is a project of the Center on Budget. It's designed to provide training and resources to facilitate enrollment in the ACA health insurance marketplaces and Medicaid. The Center on Budget is a nonprofit policy organization, but we are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. This session is not intended for press purposes, and we are not able to offer continuing education credit at this time. Webinar logistics. Automated captions have been enabled for this webinar. To view them, you can click on the CC icon or the More option with the 3 dots at the bottom of your screen. There, you should have the option to turn on closed captioning. All participants will be muted and in listen-only mode. If you would like to ask a question, you can click on the Q&A icon at the bottom of your webinar screen and type your question into the box. We will be monitoring questions and will pause for Q&A throughout the presentation. We may not be able to answer every question asked, but we will try our best to get back to you after the webinar, and we will have a record of all of your questions, which we'll use as a guide for future resources and presentations. And of course, you can email your questions during and after the webinar to beyondthebasics@cbpp.org. And just a quick reminder that you will not be able to click on the screen to go to any of the links shared in the deck. But after today's webinar, we'll email a recording of the presentation and we will drop a link to the slide deck in the chat. And for our webinar schedule, here you can see the schedule of the fall series. We've been hosting a combination of traditional webinars and holding office hour sessions for topics where not a lot has changed. We are offering full-length webinars on topics where there is new information to share, like today. And we are halfway through our series, and moving forward, that will include a webinar this Thursday, delivered in Spanish. We have 2 more office hours and the quiz show to end out our series. Today's agenda will cover things that change annually, changes to eligibility rules affecting certain people who are immigrants. We will pause for Q&A, enrollment process changes and guardrails, periodic data matching, updates on previously announced changes, and more Q&A at the end. Today's presenter is Jenny Sullivan, Director of Health Coverage Access at CBPP. Now I will turn it over to Jenny to get us started.
Wonderful. Thank you so much, Aisat, and welcome everybody this afternoon. We've designed today's webinar to be a one-stop shop sort of event for folks who are familiar with many of the concepts that we regularly cover and really want to maximize their time and just know in 1 hour what's changing for next year. So in some cases, I will touch on things that we have covered or will cover in greater depth in other webinars in our fall series. So if you've been with us every step of the way, then we're glad to have you today too. And you'll probably hear some things today that sound familiar. I also wanted to mention that this Thursday, our webinar in Spanish has a very similar title, but it will not be a verbatim translation or even interpretation of the content being presented today. It'll be a mix of things that we talk about today, as well as some content that's most relevant for folks who are assisting people who are immigrants and face unique barriers to enrollment. So just wanted to clarify that, and we hope that you will join us or that you will spread the word to your colleagues and partners who may assist people who speak Spanish. Okay, so first I'm going to review factors that are updated annually. But actually, before I do that, I want to take a moment to mention one important thing that isn't changing next year. 2025 will mark the 5th year that the enhanced premium tax credits have been available to lower people's premiums for marketplace coverage. These have made a tremendous impact in making coverage more affordable and attracting more people to enroll. Monthly premium costs after tax credits fell by almost a third on average between February 2021 and February of this year. Nearly half of enrollees selected a plan for $10 a month or less during open enrollment for 2024 coverage, of course, after accounting for PTCs. And in 2024, the average enrollee saved an estimated $700 because of the enhanced premium tax credit. Now, with coverage being more affordable and with robust investment in outreach and enrollment assistance that's been ongoing since 2021, the proportion of enrollees getting financial help has steadily risen. The vast majority of enrollees in marketplace coverage, 92% in 2024, are getting premium tax credits, and half are getting cost sharing reductions, which are available to people with income up to 250% of the federal poverty level to lower their costs of getting health services with their coverage. All of this extra financial help has been critically important for people with the lowest incomes. And I also want to mention that we've gotten data recently that show that in 2023, for the first time ever, people of color comprised more than half of all marketplace enrollees. Between 2021 and 2023, marketplace enrollment among Black and Latino people each grew by over 80%, far outpacing the growth rates for other racial and ethnic groups. Many enrollees do not know, however, that they are getting more help now than they otherwise would have because of the enhanced premium tax credits. Most are also unaware that the enhanced tax credits will end after 2025 if Congress doesn't act. While we understand that assisters are not in a position to be engaging in direct advocacy, nor should they with the clients they're assisting, these are key facts that you may wish to discuss with people who are enrolling in coverage, just so that they understand the facts surrounding their coverage for 2025, both that enhanced help is available and continues to be available just as it always has been for the past 4 years in 2025, and that there is a chance that things could change going forward. And just one more note, I'm going to refer to either PTCs or premium tax credits or advanced premium tax credits throughout the rest of the presentation. But I want to clarify that right now, if a person is getting a premium tax credit, they are getting the enhanced premium tax credit. There isn't a difference between sort of people getting enhanced PTCs and regular PTCs right now. Anybody getting a premium tax credit is getting the enhanced premium tax credit. Okay. So with that important not changing thing out of the way, let's talk about what is changing. There are several factors related to marketplace eligibility and enrollment that are indexed annually. So they change every year. And we roll those up into a one-page front and back guide so that you have everything in one place. This includes the federal poverty levels for 2024, which are used to determine eligibility for the 2025 coverage year, the expected premium contribution, which is used to calculate a person's premium tax credit amount, the employer-sponsored insurance affordability threshold, the maximum amount people can be required to pay towards cost sharing for the year, and the affordability exemption threshold for catastrophic coverage. Then on the back of this guide, you have the tax filing thresholds for 2024 and the repayment limits for advanced premium tax credits, as well as the federal poverty levels for last year. And these matter for folks, of course, when they're reconciling their 2024 tax credits. So federal poverty guidelines. Eligibility for premium tax credits in coverage year 2025 is based on the 2024 poverty guidelines. These will be used starting with eligibility determinations during open enrollment and will be used throughout 2025, including, for example, to determine eligibility for the premium tax credit for people with special enrollment periods during 2025. The marketplace uses the federal poverty levels that were in effect as of the first day of open enrollment for the entire coverage year, even though the federal poverty guidelines will be updated in early 2025. Eligibility for Medicaid, on the other hand, is based on the guidelines in effect at the time of application. Because the marketplaces and Medicaid agencies sometimes update their systems at slightly different times to reflect these new FPL levels, there can be periods where a marketplace would make a different determination of Medicaid eligibility than the Medicaid agency. So just to note that sometimes that does happen. Okay, next we have the employer affordability and the affordability exemption thresholds. And these terms of art sound really similar and they often get mixed up, so I wanted to take a moment to explain each one. The employer affordability threshold comes up when a person is applying for marketplace coverage with premium tax credits and has an offer of employer coverage, either from their own employer or through a family member. And if the cost of that employer coverage exceeds the employer affordability threshold, it's considered unaffordable, and the person can get premium tax credits, assuming that they meet all the other eligibility criteria. This year, that threshold is 9.02%. Last year, it was 8.39%. Now, the affordability exemption threshold, on the other hand, is a totally different thing. It applies to people who are enrolled in or considering catastrophic health plans. This is a tier of plan with a high deductible, and typically very few services are covered before the deductible is met, other than preventive services and 3 primary care visits per year. People can't use PTCs, premium tax credits, to purchase a catastrophic plan. These plans are only available to people under age 30 unless their marketplace premium or employer coverage cost would be more than the affordability exemption threshold. So this year, that threshold is 7.28% of income. Now, this, again, is a really small number of people, particularly in comparison to people with offers of employer coverage and needing to work out the employer affordability threshold. Only about 59,000 people are enrolled in catastrophic plans right now, but they are a more affordable option for people who expect to have very few healthcare needs in a given year, and so they remain available. Out-of-pocket maximums. So the out-of-pocket maximum is the highest amount an enrollee can be charged for all cost sharing during the year for in-network covered services, including deductibles, co-payments, and co-insurance. The maximum for a family is double the maximum for an individual. And these amounts are indexed and change from year to year, but plans don't have to set this amount as their individual plan's out-of-pocket limit. They just can't exceed these amounts. Most people won't hit the out-of-pocket limit for their plan, but these limits ensure that people who face very high costs are protected. The out-of-pocket maximums for 2025 are actually slightly lower than they were for 2024. So that is not an error. Next, we have the advanced premium tax credit repayment limits. These are also indexed, and these are the limits here for the 2024 tax year, which is most relevant right now since people will start filing their 2024 taxes in a few months. These are slightly higher for 2024 than they were for 2023. And remember, people whose income when they file taxes, if their income is greater than 400% of the federal poverty level, they have to repay the full amount of any advanced premium tax credit they received that's greater than what they were ultimately eligible for. But because of the enhanced premium tax credits and the rules around that, some people with income over 400% of the federal poverty level are actually eligible for a certain amount of premium tax credit right now. So some people will not have to pay back every penny of an advanced premium tax credit they received just because their income is over 400% of the federal poverty level. Okay, finally for this section, the last thing in this list of factors that are updated annually and worth knowing about for enrollment purposes is the standardized plan parameters. Standardized plans were reintroduced on healthcare.gov in 2023, and many state-based marketplaces also offer them. And on healthcare.gov, they're labeled easy pricing plans. All easy pricing plans have the same cost-sharing requirements within a given metal level and must offer certain services before the deductible is met. For example, all bronze easy pricing plans will have the same deductible, out-of-pocket max, copays, and coinsurance. All health insurance companies who offer health plans on healthcare.gov are required to offer a standardized plan for each metal level, each plan type, and for each service area that they offer non-standardized plans. This can make it easier to compare plans based on premiums or on other factors that are important to the enrollee, like provider network or drug formulary. Otherwise, cost-sharing charges get pretty mystical pretty quickly, and it can be difficult to make anything that resembles an apples-to-apples comparison. There were minor changes and adjustments to these limits between last year and this year, but nothing major, and that was intentional. We want to keep these as stable and with relatively few changes as possible. Now let's talk about changes in eligibility affecting some people who are immigrants. So as many of you likely know, starting November 1st, people with deferred action for childhood arrival status will be eligible for marketplace coverage and premium tax credits for the first time ever. And it's estimated that about 100,000 people will be newly eligible for coverage. People with DACA will also be eligible for the basic health program in states that have that. Although the original regulation proposed to make people with DACA also eligible for Medicaid and CHIP, this was not included in the final rule. In addition to removing the exclusion of people with DACA, the regulation also made a number of other clarifications for several immigration statuses that are already listed as lawfully present. Now, rather than go through each of these, you've got a short list here on the slide. I'm going to refer you to our recently updated FAQ on eligibility rules for people who are immigrants. And I also highly recommend, if this is an area that you spend a lot of time in and that you need to know the rules really well, that you listen to the recording of our Beyond the Basics webinar from September 17th with my colleague Shelby Gonzalez and Gabrielle Lessard from the National Immigration Law Center. They get into lots of details and lots of examples, and that's the best place to really, I think, absorb some of these technical changes. So, just to say a little bit more about it, people with a lawfully present status are eligible for marketplace coverage. And this is different from the lawfully residing definition for Medicaid and CHIP. So this table shows you which immigration categories are eligible for marketplace coverage and the basic health program starting November 1st. The left column shows lawfully present statuses that meet the restrictive federal Medicaid standard, and the right shows statuses that don't. As you can see, for example, DACA is listed on the right because people with DACA do not have an immigration status that makes them qualified for Medicaid. And then here, also under the changes effective November 1st, people applying for certain statuses are also eligible, but in some cases, individuals 14 or older must also have employment authorization. So this part of the table just teases those out a little bit. But again, if you listen to the recording of the webinar from September 17th on our website, you will get a lot more details about these changes. So some additional tips when it comes to these changes for people who are immigrants. People who submit an application for 2024 coverage and select a plan during the month of November will qualify for a special enrollment period for marketplace coverage that could start December 1st, assuming they also select a plan before the end of the month. This won't make sense, though, for some people. Having only 1 month of coverage means you're highly unlikely to hit your deductible. Not that that's a goal, but it just means that folks may be spending down toward a deductible that they are very unlikely to meet in just 31 days. And they will still need to reconcile that single month's advanced premium tax credit at tax time next year. It's still available, and there's nothing wrong with enrolling in coverage, particularly if folks have a need and know that they are likely to use healthcare services during December. But just to note that there are some trade-offs. Also, although people with DACA remain ineligible for Medicaid and CHIP, if they would be eligible for Medicaid or Medicaid in their state, if it weren't for their immigration status, then they are eligible for premium tax credits, even if their income is below the poverty level, which is great. Now be sure, as you're working with folks who are newly eligible because of these changes, that you complete everything on the application to the greatest extent possible. Don't leave anything blank because that is a surefire way to fire up a data matching issue. For folks that do run into data matching issues, upload documentation or help people upload their documentation, and then keep an eye out for people who get the wrong PTC determination or who are incorrectly sent to Medicaid. Our webinar from September 24th goes over best practices for helping people in these situations, and a recording of that, of course, is also available on our website. The last thing I'll say about this is that we've gotten a lot of requests for outreach materials and guidance for this newly eligible group, which we love to see. It's wonderful that there's so much enthusiasm for making sure that people don't miss out on this new opportunity. Beyond the Basics does not currently have outreach materials, nor is that typically our niche, so it's not something that we plan to provide. But I want to make sure people look out for our forthcoming Beyond the Basics newsletter, because we will include a link to an effort called ACA for DACA, led by some of our national partners, Young Invincibles and the National Immigration Law Center, who are putting together a toolkit of resources to help support outreach efforts for this new group. So check out our newsletter for the link where you can sign up to get more information and make sure you get that toolkit when it is available. And with that, I think we're ready to pause for our first round of Q&A.
Yes, thanks, Jenny. So first question we have here in the Q&A chat is, how do you calculate if someone can get marketplace versus their employer insurance?
Sure. So one of the criteria for being eligible for marketplace, well, for being eligible for a premium tax credit, so that means for somebody who wants financial help with their marketplace coverage, is determining, do they have an offer of affordable and adequate employer-sponsored insurance? Because if they do, then they can't get financial help to enroll in a marketplace plan. In order to determine that, you need to talk with the person, or if this is you, then you need to look at your employer plan and determine if your premiums for that plan, let's say it's just a single adult household of one, then we're going to look at what percentage of their household income their premiums would comprise for employer coverage. And if they would exceed that 9.02% threshold for 2025, then that means they can, quote, cross the firewall. That means they are not restricted from enrolling in marketplace coverage and can get a premium tax credit. The rules are similar for household members. You would look at the cost of employer coverage that would cover everyone in the household and compare the cost of employer coverage for covering all of those individuals to that 9.02% threshold. And if it exceeds 9.02%, then the other family members could qualify for a premium tax credit. And you do have situations where the employee and the other family members fall on different sides of that fence. And so they might have to consider whether they sort of what the best option for them is, whether it's a combination of marketplace coverage with a premium tax credit and employer coverage, or marketplace coverage with a premium tax credit paired with full cost marketplace coverage, et cetera. Or there's a lot of different ways to do that. And it's important to help people kind of sort out their options so they can make the best choice.
Thanks, Jenny. So another question that's in the chat is, for the employer affordability threshold, is that for the total healthcare cost for the year, including medications, or just the price of the premiums?
Good question. So that is just the cost of premiums, has nothing to do with the plan design or the person's out-of-pocket costs for getting care. The employer coverage that's offered has to be, I mentioned it very quickly in my previous response, but it has to be, in addition to being affordable, it has to be adequate, meaning it has to have at least a 60% actuarial value and be sort of real insurance, not an indemnity plan, for example. But most employer coverage meets that threshold. It is not an incredibly high one. So most of the time, if there's an offer on the table, it is an adequate one. And I'll also mention that there is an employer-sponsored coverage tool available through healthcare.gov. It's just a PDF. It's just something you can print out and fill out, but it asks questions to help people ascertain whether or not their coverage meets the standards or not.
Okay, we have a couple more questions that popped up in the chat. If household income falls over 400%, they would not qualify for APTCs, correct?
Good question, and good thing for me to clarify. So right now, this sort of package of enhanced premium tax credits, let me just explain a little bit more about what it does, because I will get at the answer to that question, but there's a lot of pieces there that are important to know about. So we have lower required contribution percentages for everybody who everybody with income over 100% of the federal poverty level. And that percentage is part of the calculation for how much a premium tax credit somebody qualifies for. It's not that every person, depending on their income, has to pay a specific percentage of their income per se. That's just tied to what they would pay for the second lowest cost silver plan. But at any rate, that percentage is lower for everybody. People with income at 150% of poverty and lower can qualify for that benchmark plan with a 0 premium contribution, meaning they can get a pretty decent silver level plan without having to pay any money out of pocket for their monthly premium. And people in that situation can also enroll at any time during the year. There's a special enrollment period that applies to anybody with income below 150% of the federal poverty level. So if they miss open enrollment, then they can come in at a different time during the year. And they can also change plans throughout the year, up to 1 time per month if their income is below that threshold. Now, all of that is winding up to the final piece of the sort of premium tax credit enhancement package, which, and to answer this question, people with income over 4 times the federal poverty level, before the enhanced PTCs, were not eligible for any help. There was a cliff there, and if your income was at 401% of the federal poverty level, you did not qualify for any premium tax credits. Since 2021, people with income over 400% of the federal poverty level can qualify for a premium tax credit if their cost of the cost of premiums for them on the marketplace would exceed 8.5% of their income. So not everybody over 4 times the federal poverty level is going to have that situation. And obviously it becomes less and less likely the higher their income is, because that's a higher and higher premium amount that they would have to exceed. But it does soften that cliff and allow some people with who would otherwise have very high premiums, particularly folks who are a little bit older, but not quite eligible for Medicare yet, and people in states with very high healthcare costs, to qualify for help that didn't before.
We have a clarifying question in the chat. Doesn't healthcare.gov help determine if the employee is eligible for advanced premium tax credit?
The healthcare.gov application will ask questions to help determine if somebody is eligible, but they will have to answer they will have to provide some information about whether they have an adequate and affordable offer of employer coverage.
And I think one last question before we continue with the presentation. If their employee only offers insurance through COBRA, would they still qualify for advanced premium tax credits?
So that's a good question too. If a person is losing employer coverage and they are then offered COBRA coverage, they can, if they've lost employer coverage, they have a 60-day special enrollment period during which they can enroll in the marketplace. And they can enroll in the marketplace at any time during that 60-day period, even if they hopped onto COBRA and went, oh my gosh, these premiums are really expensive. This is not what I want after all. They can switch back over to the marketplace as long as it's before the end of that 60-day period. If somebody enrolls in COBRA coverage and they are outside of their special enrollment period, then they can't qualify to get back in the marketplace coverage, back in the marketplace, even if they drop their COBRA. If somebody has COBRA coverage, then they're enrolled in it, then they have to wait until the next open enrollment period to enroll in marketplace coverage, and they would drop their COBRA coverage effective whenever their marketplace coverage started.
Thanks, Jenny. We will have another Q&A session at the end of the presentation, so please feel free to continue adding your questions in the Q&A chat.
Okay, got a little bit of water and I'm ready to go. Okay, so let's see, there we go. So now I'm going to go over some of the other changes coming this year that will affect the enrollment experience. First, we'll talk about those, then we'll talk about a few things kind of happening around the periphery that won't affect the application process, but that are important to know about. But first, the ones that you really might need to know about as you're helping somebody through an application. So the first is more standardized open enrollment dates. So we've seen increasing standardization of open enrollment dates in recent years and really coalescing around this sort of November to January period. But effective 2025, all marketplaces must hold open enrollment between November 1st and January 15th or later. State-based marketplaces can choose longer open enrollment periods, but they can't start before November 1st or end before January 15th. The one exception that comes through sort of a grandfathering provision is Idaho, which states that had an earlier start date for their open enrollment period when this regulation went into effect, can keep that for however many consecutive years that they hold that earlier open enrollment date. But if they were, for example, to change to November 1st at some point, then they are locked in forever at November 1st. And the open enrollment period has to be at least 11 weeks. As you can see here, we've also got these 6 other states with state-based marketplaces that have open enrollment periods that end later than January 15th. Okay, so there are also some new rules in place starting this year that affect the enrollment experience for people who enroll via a web broker rather than the official marketplace website in their state. Web brokers are now required to update their displays. This is things like help text and font size, language access, to closely align with any changes on healthcare.gov. And I'm saying healthcare.gov here because currently web brokers are not active in states that use that don't use healthcare.gov, although that is certainly a possibility. And so the rules contemplate that and bring the rules for state-based marketplaces into alignment with healthcare.gov. Although most state-based marketplaces don't currently allow web brokers, this change is going to require web brokers in those states to align with the state-based marketplace. So this requirement is actually already in place for what we call enhanced direct enrollment entities, and there's a whole lot to say about enhanced direct enrollment and direct enrollment, but for really simplification purposes, I've got a little box on the side here. You can think of enhanced direct enrollment as an enrollment pathway through an issuer or a web broker that does not require the user to visit healthcare.gov. And direct enrollment is a pathway that does. There are more differences than that, but that is at its boiled down simplest form, a way to keep those straight. So the requirements for closely aligning with the marketplace were already in place for enhanced direct enrollment entities, but they are now also in place. It is new that they apply to direct enrollment entities as well. And if these entities want to deviate from those requirements, they have to get approval from HHS first. Okay, on to incarceration status verification. So this administration has already done a lot of work to streamline enrollment and reduce administrative barriers to verifying eligibility. And this is just one more policy along those lines. People who are incarcerated are, of course, not eligible to enroll in marketplace coverage unless they are incarcerated pending disposition of charges. And previously, the marketplace could request verification that an individual is no longer incarcerated if their response to the incarceration question on the application was not compatible with the information in the federal data hub. However, what HHS realized is that this was resulting in a high number of data matching issues, and most of the individuals with these DMIs were ultimately found not to be incarcerated, which means we spent a lot of money and time erecting these administrative barriers that made it harder for eligible people to get coverage. So what's changing this year is that in healthcare.gov states, people's attestation of their incarceration status will be accepted without requiring additional documentation. State-based marketplaces can choose to go this route, or they can use a different approved data source. There's also a streamlining change affecting people enrolled in catastrophic plans. Just a reminder, talked about this a little earlier, but a catastrophic plan is a plan with a low monthly premium, but a very high deductible, and premium tax credits and cost sharing reductions are not available for catastrophic plans. The only people who can enroll in them are people under age 30 or people over age 30 who meet an affordability exemption. These are not very common, but again, they do help some people get coverage who couldn't afford it otherwise. And the change for next year is simply that people enrolled in a catastrophic plan will be automatically re-enrolled in a similar bronze plan on the marketplace if they become ineligible for their catastrophic plan, either because they age out or they lose their affordability exemption. This helps ensure that people have continuous coverage, don't face gaps, and don't need to come back to actively re-enroll to keep their marketplace coverage. In another streamlining and simplifying move, starting next year, all marketplaces must adopt the first day of the next month rule for special enrollment period eligibility. A person's coverage becomes effective on the first day of the month after they select a plan, even if they select a plan on the last day of the month. So this change applies to all special enrollment periods that have a regular coverage effective date. So think of things like loss of minimum essential coverage, marriage, a move, the low-income SEP. Really, most SEPs have this regular coverage effective date. And it replaces the former 15th of the month rule that said if you select a plan by the 15th of the month, your coverage is effective the first day of the following month. If you select a plan after the 15th of the month, then you have to wait till the month after the next month before your coverage starts. And you can refer to the SEP chart linked at the top of this slide for a detailed list of special enrollment periods and their effective dates. And I also added a note here to remind folks that last year, CMS announced a new option for marketplaces to allow people whose non-marketplace coverage ends in the middle of the month and who qualify for the loss of minimum essential coverage special enrollment period. It allows these folks to have their new marketplace coverage start the first day of the month that their other coverage ends. So it starts before their other coverage ends and they have a few weeks of overlap. So for example, if a person's Medicaid coverage ends on March 15th, they could apply for marketplace coverage. And if they selected a plan by the last day in February, then their marketplace coverage would start March 1st. And this change is intended to reduce short gaps in coverage for people in these circumstances. And healthcare.gov will be making this change, although it is not effective on healthcare.gov just yet. We continue to check back in with them, and they have assured us that they will shout it from the rooftops when this change has been, the technical side of this change has been made. And state-based marketplaces also have the option to make this change. Okay, the low-income special enrollment period. I mentioned this when I was talking about all of the things that come along with the enhanced premium tax credits. So there's a change. It won't be immediately obvious on the surface when you're helping somebody with an application, but this change will help stabilize this really critical recent improvement in marketplace eligibility. So the low-income SEP for people with income at or below 150% of poverty started in 2022 and was linked to the availability of the enhanced premium tax credit. It was specifically linked to whether people had access to a zero premium plan. The thinking at the time was that this linkage helped protect the marketplace risk pool from adverse selection because people who have access to a zero premium plan, meaning they don't have to pay anything to be enrolled in it from month to month, wouldn't have an incentive to only stay enrolled in months when they needed healthcare services. This SEP has been crucial for people losing Medicaid after the end of the continuous coverage requirement, and it's resulted in a significant increase in marketplace enrollment among people with income at or below 150% of poverty. More than half of healthcare.gov plan selections for 2024 were among households with income at this level. So CMS has re-examined the data on adverse selection and determined that even if the enhanced premium tax credits expire at the end of 2025, the risks of adverse selection are less than they originally believed them to be, and they're outweighed by the benefit of making enrollment easier for people with very low incomes. So going forward, CMS has said that this low-income special enrollment period will remain available regardless of the fate of the enhanced premium tax credits. Just going to pause for a drink of water here. Okay, so there is also a new option in 2025 to allow marketplace enrollees becoming eligible for Medicare who have a retroactive effective date to choose to terminate marketplace coverage back to that date. Now, it's true that most people becoming eligible for Medicare know their effective date in advance, and they can contact the marketplace and ask to end their coverage the day before their Medicare starts, so they don't have an overlap. But in some cases, people can become eligible for Medicare retroactively. For example, if they have a retroactive SSDI determination. And if they have marketplace coverage, that means they could end up having months where they have overlapping coverage and they're paying a marketplace premium unnecessarily. So people in this situation can now request to end their marketplace coverage retroactively. It is up to the individual as to whether they want to do this. They don't have to do this, but if they're facing this choice, it's important to help them understand that it is then their responsibility to make sure that any health claims during those months are submitted to Medicare and not to their marketplace plan, which if they've ended it, will not pay those claims. And marketplace issuers would need to refund any advanced premium tax credits that they received during the months for which coverage was retroactively canceled. Okay, one other thing that you will notice is new on the healthcare.gov application this year is this new question asking applicants if they want more information about registering to vote. This question was launched a couple weeks ago, so if you're helping people right now, then you may already have seen it. It is an optional question. You can skip it. You could select prefer not to answer. If you select yes, or if the applicant selects yes, then it directs them to vote.gov to get information about how to register to vote or update their registration information. Okay, now I'm going to move on to periodic data matching updates and away from the initial application process. Now, periodic data matching is the process that happens at different times during the year to ensure that marketplace enrollees who are getting premium tax credits are simultaneously enrolled in another public health coverage program like Medicaid, CHIP, Basic Health Plan, or Medicare. Marketplace enrollees with premium tax credits who are identified as being enrolled in one of these other programs will get a notice in the mail and need to verify that they are not enrolled by the date specified in the notice or risk losing their APTC. So one of the changes for this year is a change to the periodic data matching process for enrollees who are deceased. There is another process for PDM for people who may be deceased to ensure that their enrollment is terminated quickly. This helps reduce overpayment of advanced premium tax credits and prevent automatic re-enrollment of people who have passed. However, at the most recent update of the marketplace PDM rules, there was a requirement that started for all marketplaces to send PDM notices at least twice a year, but it didn't include the process for conducting PDM for enrollees who are deceased. So starting in 2025, all marketplace enrollees are also required to conduct PDM at least twice a year to identify enrollees who may be deceased. There's also a change to PDM for Medicaid and CHIP in healthcare.gov states just for this year, for 2024, that I wanted to make sure folks know about just in case people bring in notices or need help understanding. So because many people are still navigating eligibility and enrollment challenges due to Medicaid unwinding, and many state Medicaid agencies still have large backlogs and long application processing times, healthcare.gov is not terminating APTCs this year for people identified with Medicaid or CHIP periodic data matching issues, or periodic data matching. I should not confuse this with data matching issues in 2024. So the marketplace still sent people notices in August as a courtesy, but advanced premium tax credits are not going to be terminated this year, even if a person doesn't act on the potential overlapping coverage. But the process will resume as normal for next year. So it's safe to assume just always act on these notices. If you get one, look into why the marketplace may think you have Medicaid coverage or another form of coverage and work to get that resolved. And here you can see, we've got the link at the bottom so you can see it bigger if you'd like. This is a sample notice that people would have gotten in August if they had that Medicaid or CHIP periodic data matching notice. And the only thing that's particularly different from kind of the regular PDM notice is that this one doesn't say, and you must act to verify that you don't have Medicaid or CHIP by a certain date or risk losing your APTC. So pretty straightforward. Okay, so now I'm just going to review a few things that we've known were coming. They are not new per se, but they're relatively new, or they're being implemented for the first time this enrollment cycle. Failure to reconcile. So this is the process through which the IRS shares data with the marketplaces about people who've received advanced premium tax credits but haven't reconciled them at tax time. The marketplace then notifies people in this situation that they have to reconcile their past APTCs by a specific date, or they will lose their current year PTC. CMS paused the failure to reconcile process during the pandemic to provide additional relief during that time, but they announced last year that they were planning to restart it soon. And they announced in the spring that the process would resume November 1st, 2024. The good news is we are shifting now to a process where people aren't at risk of losing their APTC unless they failed to reconcile for 2 years instead of just 1. The new FTR process has to be followed in all states, regardless of the marketplace type. So let's take a look at the steps in the process. So first, the marketplace will get information from the Federal Data Hub about enrollees who have a failure to reconcile status, either 1 year or 2 year, and this will be based on 2022 and 2023 tax data. Before open enrollment begins, and I think these actually have already gone out, the marketplace will send a notice to the tax filer and to the specific affected individual, because remember, we can have tax filers who are claiming the PTC for somebody else in the household who's actually getting the coverage. And if those are 2 different individuals, both of those individuals will get a notice about this. And people with 1 tax year FTR will get a notice explaining you have this status and you need to reconcile your tax credit, and here's how you can do that. People with 2-year FTR will get a notice explaining the same, but then it will also tell them that they're at risk of losing APTC for 2025 if they don't take action in time. And if when they are applying for coverage for 2025, they will have the opportunity to attest that yes, they have filed and reconciled. And if they say, no, I have not filed and reconciled, when they submit their application for 2025, they will not be eligible for APTCs for 2025. And at that moment, going forward. Now, if a person has gotten a filing extension, they can attest on their marketplace application that they have filed and reconciled. But if they haven't, then the marketplace is going to discover this during the recheck process that's I'm going to describe on the next slide, and they'll still be at risk of losing their advanced premium tax credit. People should file their taxes and reconcile past APTCs, then come back to the marketplace application and change their, attest that it actually won't be selected when they go in to make a change on the application, but they will go in and attest that, yes, I have filed and reconciled my past APTCs, and that will help kind of put them in line for the recheck process to make sure that they have done that. So the recheck process, in the latter half of January, the marketplace is again going to check people's status and send more notices depending on the outcome. People with 1-year FTR who have not filed and reconciled will get another notice explaining that they're at risk for 2-year FTR and potentially losing APTCs in future years. And people with 1-year FTR who have cleared the FTR are considered to have, quote, passed recheck, and they'll be taken off that list for the process for the following year. People with 2-year FTR who have not filed and reconciled will get a notice telling them that they have to take immediate action or risk losing APTC for the remainder of 2025. There is an additional recheck then conducted in April, and if people with 2-year FTR still have not filed and reconciled their past APTCs by that time, then they will lose their 2025 APTCs effective May 1st. So some tips to keep in mind. If a person has 2-year FTR and doesn't take action, the marketplace will end their APTC, but they will not be disenrolled from marketplace coverage. They will be on the hook for the full premium, but this also buys them some time if they're able to reconcile file their taxes, reconcile, and then come back and they can have their APTC restored. But that's only if they remain enrolled. If at the time that they lose their APTC, they also cancel their marketplace coverage, then they can't re-enroll in marketplace coverage again until open enrollment or until they have they qualify for a different special enrollment period. People who believe that they have filed and reconciled but lose APTC anyway, maybe the IRS data are not reflecting reality for some reason, then they do have the right to appeal this decision to the Marketplace Appeals Center. Okay. A reminder that our bronze to silver auto re-enrollment process will continue on healthcare.gov this year. and SPMs have flexibility to adopt similar practices. This is people who are enrolled in a bronze plan, but who could be enrolled in like this year, but could be enrolled in a silver plan with cost sharing reductions offered by the same issuer with the same provider network for the same or lower premiums for 2025. And if that's true, then the marketplace will automatically enroll them in a silver plan instead for 2025. As with all automatic re-enrollment, people can actively renew before December 15th to avoid this process, and they have until January 15th to select a different plan if they don't want the one that they were automatically assigned to through this process. But in most cases, this change is going to result in people having lower out-of-pocket costs and not any other real perceptible differences in the coverage. So it hopefully is helping people more than it's not. And this change affected about 250,000 people in 2024. Okay, reminder that we are also entering our second year where optional questions about sex assigned at birth, sexual orientation, and gender identity are included on the healthcare.gov application. This information is not used for determining eligibility, for setting plan prices. It's not shared with other agencies or with health insurance issuers. It is being collected to help improve the enrollee experience by sharing information about their identity that better reflects and affirms their identity. And it will also help inform efforts to analyze LGBTQ+ population disparities in access to coverage. Now, it's up to the person applying for coverage whether they want to respond to the questions, but they should always be given the opportunity. They can choose to skip them, but that should be their choice. And assisters should be prepared to explain as part of this how the information will be used, because that might be a question that an applicant would have. Assisters should not skip these questions and should not guess the person's responses based on their own observations. Okay, bringing it home here with unauthorized enrollment. I know many of you are really aware of the spikes in unauthorized plan switches and unauthorized enrollment in marketplace plans in recent years. It's really come to a head this year. CMS has been working to aggressively tamp down on this activity and hold the offending entities accountable, and also to make affected enrollees whole. But it's a dynamic process and it's a work in progress. Agents and brokers who are not associated with a person's enrollment on healthcare.gov are now blocked from making changes to that person's account. Agents or brokers can make a three-way call with the consumer and with the marketplace call center to add or change the agent or broker associated with the consumer's account. In addition, applications submitted through direct enrollment or enhanced direct enrollment will now require a Social Security number. The application will not be accepted if there's not an SSN included for all applicants. Changes are also coming in December to allow agents and brokers to submit applications through these pathways for non-citizen applicants who don't have Social Security numbers, but do have other forms of documentation to verify they have legally present status. And people whose applications are blocked as a result of these changes can still apply directly through healthcare.gov or through the marketplace call center. This only affects the direct enrollment and enhanced direct enrollment pathway. Now, as a result of changes in recent months, reports of unauthorized enrollment activity are down significantly, but it can take time for people to realize that they've been a victim of this problem. So you may still encounter people who are realizing that they've had their plan switched or they've been enrolled in a marketplace plan without their knowledge or consent. And when you do, if you do, you can work with them to contact the marketplace call center to report the concern. And the person can, the call center can work with the person to cancel an unwanted plan, to enroll them in a new plan if they want, to ensure that people are made whole for any out-of-pocket expenses that they should not have incurred as a result of an unauthorized plan switch, and to ensure that the person gets corrected tax forms. Assisters can also submit complex case forms and request retroactive terminations on behalf of the consumer if that is what the consumer wants. And with that, we're ready for a few more Q&A before the top of the hour.
Yes. Yes, we have a couple of questions that we can get through. So the first question, will people have to pay back the advanced premium tax credit if they are in 2-year FTR and don't file taxes? Any consequences for this?
That is correct. People will be liable to pay back APTCs received during those months when that recheck is happening if they don't resolve the prior year's tax credits that haven't been reconciled.
And this is a little bit of a longer question, so I can reread if need to. It says, so you can enroll for 2025 and attest to having reconciled for the past 2 years if records suggest that you have not, and get PTCs, but there will be a data check in January. And if your attestation was not true, you will lose your PTCs immediately.
Word. Let me,
And I can reread it if you.
no, I was gonna go back to the slide. Sorry for the sloppiness here, but let's go back here. So actually, let's go back one more slide. So if people are in that 2-year status, there's one decision point when they're applying for 2025 coverage, and they will have to attest that they have filed and reconciled. And if they do, then they can retain their APTC for 2025, and we assume that they actually have filed and reconciled or are in the process of getting that done. If at application time they don't attest, then their eligibility determination notice for 2025 will say no APTCs for you. Let's follow then sort of that orange box down. There'll be the January recheck, and at that time it's possible that the person has filed, reconciled. Great, so we're going to follow the pathway along the sort of left side of the 2-year FTR status. The data indicate the person has filed, so they pass the recheck process and they're done. If in January that recheck happens and the IRS data indicate that the person still has not filed and cleared things, then they are going to get another notice. So they've got a few months into the year between January and April where they're continuing or could potentially be continuing to get APTCs. But once they get that final notice, they will lose their tax credits effective May 1st if they don't pass April recheck. And people can also, there are copies of the sample notices that healthcare.gov will be sending as part of this process at the link on the upper right corner of the slide. So if you want to see exactly the language that people are likely to have, then that can be helpful as well.
So we're going to squeeze in one last question. If an immigrant has DMI issues and the APTC is not calculated correctly, will that be an appeal issue, or can we update their application once the DMI has been resolved, or once the DMI has been verified? Sorry.
So that's a good question. I think the best thing to do to get more tips around this process is to check out our September 24th webinar, because it's a whole hour about kind of how you resolve these, and actually our webinar from last week as well that's specifically about data matching issues. But people should be submitting information, resolving the DMI, and then they should have sort of a correct APTC determination. If for some reason that is incorrect, then you would have to go back to the marketplace and either submit an appeal or work with the call center to figure out what's going on. But things can get messy when you're sorting out kind of, there can be multiple DMIs, there can be issues with income and with immigration status, there can be issues with whether somebody's eligible for Medicaid based on their immigration status or not, and whether the application gets forwarded to Medicaid. So things can get pretty complicated, which is probably exactly why the person was asking that question. So I'm sorry, I don't have a more concise answer, but our September 24th webinar has some more details that could be helpful, and happy to take questions through our Beyond the Basics email inbox as well to help parse these things more clearly.
Thank you, Jenny. So here are the resources that were presented in today's webinar. And as Jenny mentioned earlier in the session, our next webinar, What's New for 2025, delivered in Spanish, is this week, Thursday, October 10th at 2 p.m. Eastern Time. And you can register for this and other upcoming webinars on the Beyond the Basics website under upcoming webinars. If you have any questions or need any assistance, please feel free to email Jenny or our general Beyond the Basics at cbpp.org email. We will be distributing the materials from today's session via email. And if you are not subscribed to our newsletter, we will post everything to the Beyond the Basics website. So you will see all of the materials from today there. So with that, I will bring this webinar to a close. Thank you everyone for joining. Hello, everyone. I'm gonna give it a few seconds to let people roll on in.